What's up, people? Welcome to episode 57 of the Unofficial NCLEX podcast. The title of this episode is Use Clinical Decision-Making and Critical Thinking for Emergency Response Plans. So let me walk through this with you. The first thing we want to think about as with clinical decision-making is something called primary and secondary assessments. So, we've got our primary assessment where we're identifying immediate high priority needs. So looking at a patient and say, they are bleeding out. They need an airway. They're choking on their own vomit. Identify these ABC, airway, breathing, circulation, high priority needs and address them now. So putting in the airway, putting pressure where the bleeding is, dropping a DOB or dropping an NG tube and getting all the gunk suctioned out. That is your primary assessment. Once we have this immediate need addressed, we go back through and do our secondary assessment. So therefore, we identify the next high priority need. So we're thinking about things like getting a set of vitals, doing an actual neuro exam, doing a cardiac assessment, seeing what kind of pain they're dealing with, where it is, how bad it is, actually talking to the patient, getting some history, or doing maybe even a focused assessment. So we want to get our primary and secondary assessments done. Then while you're doing this, though, keep in mind your hierarchy, Maslow's hierarchy of needs. So, when we're in emergency mode, we're not worrying psychological as much right now. We are making sure this patient has a pulse and can breathe and isn't actively bleeding and isn't in any imminent danger. We want to stabilize. That is the goal, to stabilize when we're in emergency response, okay? We also, something to consider in emergency response is not only just stabilizing the patient and doing our primary and secondary assessments, but what's also important is considering our resources that we need to provide care as well as time constraints, right? So something to think about is, this patient really needs an MRI, but it would take hours to get an MRI and get it read, and the machine is down. Okay, we have a time constraint, and we also, the machine is down, like our normal resources are not available. So in those situations, we really have to use critical thinking and clinical decision-making with our providers to work around problems that may present in an emergency situation. So, do your assessments, address the immediate high priority needs, and when you're not sure what to do next, think ABCs, airway, breathing, circulation. Also think Maslow's hierarchy of needs at that time, okay? So remember how that sort of pyramid works out, and we're working on like the top of it right now to make sure that they are stable, that their heart is beating, their lungs are breathing, and then we start your brain is working, we've got reflexes and everything, and we start working down from there. And keep in mind your resources that you need to provide care as well as time constraints, okay? So we're not, utilizing resources that are not absolutely necessary, right? So, it's like we got 20 patients that need assistance, and I'm worried about fluffing a blanket and drawing a lipid panel. Like those things are not priorities, and they're using resources for something that's not going to make a huge difference immediately. So it's really important to consider those things when we're in an emergency situation. So that concludes episode 57. Use clinical decision-making and critical thinking for emergency response plans.
This has been another episode of the Unofficial NCLEX Prep Podcast. To get the massive PDF guide that goes along with this podcast, head over to nrsng.com/NCLEX-Prep. That's nrsng.com/NCLEX-Prep. That's a free download that you can take with you anywhere, and you can basically have this podcast in text format. Our goal here at nrsng.com is to give you the tools and the confidence that you need to succeed in nursing school, on the NCLEX, and in your life as a nurse. We want you to succeed, and we want you to become part of this movement of nurses that is dedicated and motivated to learning and becoming the best nurse that they can possibly be. My name is John Haas, RN CCRN, and I'm the founder of NRSNG.com, and I sincerely thank you for being here, and I'm so proud of you for taking this step in your journey. Now you know what time it is now. It's time to go out and be your best self today. Happy nursing.